Dr. Doreen 𝗏𝗏𝗃𝗏 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗃𝗏𝗃.
Dr. 𝗏𝗏𝗃𝗏𝗃.
Dr. Doreen 𝗏𝗏𝗃𝗏𝗃.
Dr. Doreen 𝗏𝗏𝗃𝗏𝗃 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
What is the difference between autism and intellectual disability? Because, Dr. Doreen, so often people still, 2023, and people are still making the assumption that one means the other.
Right.
And it doesn't. So talk to us a little bit about this.
So they are completely different and not related. So let's just start there. Intellectual disability just means that the individual has a lower than average IQ or intelligence quotient. And the way that you measure that is through IQ testing. And there are a number of different types of IQ tests, and so viewers will be familiar with the names of some of these. The 𝗵𝗲𝗏𝗏𝗧 is one that goes across multiple ages. The Wechsler tests, which are very well known, and there are multiple different ones. If you are I believe between the ages of 2 and 6, then you're given a Wechsler test called the 𝗃𝗶𝗱𝗃𝗃, which stands for Wechsler.
It sounds like a lawn sprayer for your kids to, the 𝗃𝗶𝗱𝗃𝗃, right?
That's for 2 to 6, and then the next one is the WISC, which is like from, I think, 6 to, I'm not sure, 11 or something. And then the next one is, or maybe even 6 to 16, and then the next one is the WACE, which is for adults. And these are all Wechsler IQ tests. And then there are also nonverbal IQ tests, like the Merrill-Palmer or the LIDAR-R. And in essence, these tests are supposed to be measuring cognitive ability or intelligence, right? And in order to actually receive a diagnosis of intellectual disability, you have to and so their intellectual disability means that you are below average IQ, and how far below establishes the level of intellectual disability. So average IQ, most of us, have an IQ of about 100. And the way that IQ is measured is it's a fraction, and it's your mental age divided by your chronological age times 100. That's how you get IQ. So if your mental age is let's say, my mental age would be 60, and my chronological age is 60. 60 divided by 60 is 1, times 100 equals 100. So my average IQ is 100.
Mm-hmm.
And most of us, that means that your mental age, your cognitive abilities have increased every year that you have aged or have become, they've grown at the same level, let's put it that way. And so your average IQ is always 100. Now, because there's a big difference in people, there's this thing called a standard deviation, which means that like 98.9% of people will be within 15 points of that 100.
Mm-hmm.
Right? So most people will be like 1 standard deviation below or 1 standard deviation above. So they'll either be 85 or 115. So somewhere between 85 and 115 are most people.
Mm-hmm.
Okay? But there are some people who are below that even
Yes.
more or above that even more. So that would be someone who is 2 standard deviations below, so their IQ is around 70, or 2 standard deviations above, so their IQ is 130.
Mm-hmm.
And if you're 2 standard deviations above, you're highly intelligent, and that's, gifted.
Yeah.
And if you're 2 or more standard deviations below, then you have intellectual disability. And as I said, they go by different levels. So there's like borderline intellectual disability all the way to profound intellectual disability, and there's multiple levels. Now, so that's kind of how you measure ID, intellectual disability.
Okay.
Which, in the old days used to be called mental retardation. It's the same basic concept.
Right.
Now let's put that aside for a minute, and that could apply to just anyone whose intelligence or intelligence quotient is below average.
Okay.
Now, autism has absolutely nothing to do with that. Autism is diagnosed completely differently. You do not do a test of intellectual ability for a diagnosis of autism. You're looking at completely different areas for autism. With autism, you're looking at two areas. One area of functioning is called social communication, and the other area is just repetitive, stereotypical behaviors. So in the social communication area, you're essentially asking about and observing specific symptoms, like, for instance, the individual doesn't give good eye contact, the individual does not have vocal communication, the individual doesn't know how to interact socially with other people, those types of things. And you have to have a certain number of symptoms in that area. And in the second part, which is the kind of stereotypical repetitive behaviors, you have things that are like, and many people who have a child with autism will recognize these, and they're very different, right? The stereotypies can be anything from lining up objects to, repetitive repetition of a vocal sound, to visual gazing, to the need to touch textures. I mean, there's a bunch of different behaviors, Shannon, that we all refer to as self-stimulatory behaviors or stereotypy. Even the sensory stuff falls into this category now, having sensory dysregulation. And so if you have those two areas are affected in the child, so you have, some issues with social communication and some issues with those kind of stereotypical behaviors. If you have enough symptoms together, then you will get a diagnosis of autism now, or autistic disorder. Now, you could also have a diagnosis of intellectual disability, but it is a completely separate thing. And the problem is that when you have a deficit with social communication, when you have difficulty understanding language, and remember with ID, you have to do those tests.
Right.
And most of those tests, the Wechsler test and the Stanford-Binet test, the most worldwide recognized tests, are verbal in nature. So they ask questions or they tell you to do things using language. So, put this there, or, imitate this, or reproduce this pattern, or what is this, or those types of things. And if you have a deficit in language, if your language is delayed, which, as we know in autism, many children, due to their sensory issues, their language is delayed. And so then you will have a very hard time understanding what you're supposed to do or what is being requested of you. So it becomes almost very, very difficult to measure your raw intelligence. It's kind of like taking a nonverbal child and giving them an eye exam. If they don't know what you're asking, they're not going to be able to respond to you, so you won't know if they're actually seeing those things, right?
Yeah.
So that's the problem. So therefore, a lot of people assume because kids with autism will actually do worse on IQ tests, so because they're not understanding what's being asked of them, they have attention issues, all these other things that are interfering with the examiner's ability to actually measure the raw IQ. So a lot of people assume that kids with autism will have low IQ or intellectual disability. And I've had cases where a regular IQ test will actually show like an IQ of, 70 or 65. And then when you give the child under very good circumstances a nonverbal IQ test, like a test that is designed for deaf children, and the child is able to attend, then there's like a 30-point difference, and the child is actually responding with normal IQ levels, right?
Yeah.
And that's super important. I always tell people to pay attention to that because, and I'm rambling now, but there's a lot of stuff that goes with, when you have a child with autism, you have to continue to try and teach them as many skills, or at least I believe you want to teach them as many skills as you possibly can so that they thrive in society, so that they are able to use their own skills and the ones that you taught them to do really well in life. And if you have a diagnosis of ID, a lot of times people just kind of give up. Yeah. And they assume that your child is not able to learn, and they make excuses and all that sort of stuff. And then honestly, if you make an assumption that someone is not able to learn and you don't attempt to teach them things that are important and adaptive and functional for them, they won't learn. There's nothing for them to do, and they will fall behind in society. And so that, to me, is very important to differentiate. It's a really important thing for those on the spectrum.
I think you've really hit on something really important, because I think for a lot of autism parents, we struggle with the idea of, when am I pushing them too far?
Yeah.
Like, am I asking them to learn something that they're not capable of learning?
Right.
And I think that's where the giving up comes from.
Right.
But I know many parents whose children were diagnosed as ID, along with autism, and the school parked them in a classroom where they were going to play with crayons for the next 10 years.
Yep.
And then later on, somebody just inadvertently, you know, talks about something with the child, not knowing this preconceived notion of apparently they're not capable of that.
Right.
And then we see this ability flourish in this child, and the parents go, oh my gosh, what did I just do that I let them be parked for 10 years? It's hard, but a couple of things I heard you say is that if we are having our kids on the spectrum do a IQ test and our kids are nonverbal, we should ask for them to have a nonverbal test.
Yes.
And
that doesn't always work, too.
Okay.
And that, I mean, it does, a lot of times it works, but sometimes it doesn't, just because our kids have a lot of visual input issues, auditory input issues, and also distractibility, right? So they can't pay attention. And just the visual input stuff itself is so important. Like, you know, so many of my kids, the very first thing I notice is that their eye contact is fleeting, right? So they're like, they're visual, they're just, it's as if the whole time they're trying to establish the box around them, right? So their eye contact is everywhere. And when you're doing that, it's very, very hard to focus on one visual thing in front of you. I mean, I know Temple talks about the visual field a lot. And that is, I think, vital to how they learn and how they understand. And so a lot of these nonverbal IQ tests have a very big visual function, right?
Yeah.
You have to pay attention to things that you see.
okay, so maybe the takeaway is that, especially when our children are young, that we should not be tied to whatever the result is. If our kids are on the spectrum, don't be tied to what the IQ tests are. Push for our kids to be able to learn.
Absolutely.
Now, on the flip, though, I do have people that I know who wholeheartedly listen to that and go, okay, they told me my child had autism and an intellectual disability, and I reject that. And we're going to push, we're going to do as much as possible. But now the kids are older, and it has become evident that the progress is not there.
Yes.
And they don't want to let go of it.
Yeah, that's also very hard because, you know, it's almost like you're pushing the child too far, and it's also very difficult for the child because they are experiencing failure.
Yeah.
And it's also very, very hard for the family unit, right? Because it's disappointing every day. So yeah, we have to have a very realistic point of view, and that's very difficult to do when it's our own child. And from my perspective, IQ does, at some point, it becomes interesting and important. It teaches you a lot about the child.
Yeah.
But I think that initially, like a lot of people, when they first get the diagnosis, at that point, I'm not too concerned about getting an IQ score right away.
Okay.
For me, in the beginning, the first year, like assuming the child is around 3, the first year should be kind of a year where you're learning about the child's learning style, and you're getting to see how rapidly the child can learn. And so as a clinician, BCBAs should be kind of experimenting and making sure that the child is progressing all the time, and if they're not progressing, you have to change what you're doing. So like this is, as you know, Shannon, like one of the things we used to do is we often would just change things around and identify, wait, is he having a hard time because the stimuli that I'm using are too small, too far, too confusing, or should I be using more visuals, more verbals? You know, we change the modality of how we're teaching, and we never assume that it's because of the child. We assume that it's because of the style of therapy or the way that I'm teaching. And you do that a lot for the first year because then you learn, okay, there is a way to teach. Now, that being said, I remember I used to have a child, a little boy. We did so many different things with him to try to get him to pay attention and learn. And honestly, it wasn't until we realized he actually had very significant hearing deficit, right? And it was very, very hard for him to learn. And so you always have to think of all these different things. You know, is his hearing intact?
Yes.
Is the vision, and it's not just standard vision, it's all these aspects of our visual ability, like being able to, binocularity, you know, being able to focus both eyes on the same stimulus, being able to track, being able to do figure-ground discrimination. These are things we do and we don't even realize it. And our kids have a very hard time with some of these things, both from a visual perspective and auditory. Sometimes
I
our
was just
kids,
going to say, auditory.
Exactly. They can't determine what is being said because background noise is too loud. These types of things are super important before we make any conclusions about their intellectual abilities.
Yeah, the English language is such a tough language to hear, and we have so many diphthongs and triphthongs, and there's a whole section, in fact, in skills that in a very interesting place where it teaches about auditory discrimination to be able to discriminate what a diphthong is and what a triphthong is, so that you can hear the sounds to be able to understand what somebody is saying. And we've seen a couple of different cases of especially nonverbal women who get to a certain age and then now are able to do it and have said, like Carly Fleischman said, I wasn't able to decode what you were saying until she was like 12.
Amazing.
Isn't that amazing?
Amazing.
So interesting. But I guess my last question is, so IQ can change? Because we were told for decades that it could not.
Yes. So actually, I remember when I was working with 𝗏𝗏, you know, at UCLA years and years ago, he had written about this and he called it the malleability of IQ. Because IQ does change, obviously, because it's funny when you do the very first time, if anyone who's a psychologist or has been tested for IQ, you know that if you just memorize vocabulary, your IQ score will go up. Because the tests, those IQ tests, are assuming that you're not specifically sitting there and prepping for an IQ test, you know? And so, but very truthfully, if you have higher vocabulary, you're going to score higher IQ. So it's very easy things like that that you can. So over time, if a child is learning more, which obviously, let's say you're in an intensive ABA program, your child's going to be learning more. So the IQ test will change. And obviously, as you know, I mean, I've published a paper on this where we had children who at the beginning of intervention, their IQ was in the 60s or 70s. We did 2 or 3 years of intervention and their IQs went into the 100 range. And so that's a very important distinction as well.
That was our case. You know, the first time that our son was tested, they came back and said we couldn't get a score. We couldn't. He didn't have enough language for us to test him. And then the next time, I remember it was within the range where we were concerned about was there going to be intellectual disability. And then the year after that, his score was so high. And I remember being disappointed. It was like a 139 or a 140, and I was disappointed. And the person who was giving me the results said, I don't understand why you're not excited. And I said, oh, well, I really wanted him to be in Mensa, and Mensa, it has to be 150. And she was like, no, in this test, the highest score is like a 142, something like that. I don't remember what the numbers were. And I was like, oh, okay. But she was like, you should be happy. You should be thrilled. And I am. And that's not everybody's story, and I have to cling to that.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.